The screen is white instead of green, okay? So today's a good day, okay?
See, it doesn't want to cooperate with you. It's copyright violation.
Okay, so we started. This is in lungs, right? This is in lungs.
I guess it's me.
Okay, what happens if you saw a pointer, let's say, on this one right here? What would you say this? It's only in one, right?
You're in the way.
So, no, that's the, oh,
Your pointer
there's only
disappears
one,
out.
so ambulance, okay. What about this one right here? Yeah, ambulance staff, okay?
Right.
Okay, if you had to identify the slide, what does the slide up?
Esau.
Esophagus.
Okay, no matter what slide we give, even if you haven't seen it, although we wouldn't, all the slides we use is gonna be from your boxes, okay? So I know you guys have all the pictures, but in saying that, any slide you have, you should be able to recognize the basic things. Like, for example, the epithelial there gives away the slide. So what is this slide of?
Esophagus.
The esophagus, right? So what type of epithelium would you find there?
Stratified.
Okay, stratified squamous epithelium, right? So that is actually what gives it away. Even on your slide in the boxes, you'll definitely see the same thing, okay? So what are the numbers? Number 2, what's number 2?
Lamina propria.
Lamina propria. And number 3? Number 4. Number 3, sir?
Muscularis mucosa. Muscularis mucosa.
Because, okay, make sure and spell them things right, okay? Half a point you're gonna lose, so spell it right. Okay, the next one is number 4, right?
Sub.
Submucosa. What about number 5?
Muscularis externa.
Okay, you see what number 6 is? What would you say number 6
Mucosa.
is? Right, the whole thing is there, the mucosa, okay? Right, because it's inclusive of the epithelia, the lamina propria, and the muscularis mucosa.
Lamina.
Lamina.
Lamina. If you say it correctly, they'll spell it correctly.
Okay. Next one. Next
Small
one.
intestines.
Alright. Identify this slide. Okay, the duodenum. Okay, so what tubule was the duodenum?
Brunner's. Brunner's gland.
Okay. Okay. First of all, if you had no idea, right, that it's the duodenum, that's a good thing, right? What would you say in general it is?
Small intestine.
The small intestine. No, why did you say it's the small intestine?
Because of the
Because
villi.
of the
Because
villi.
of the villi. Okay, so that's a giveaway. So now you have 3 choices, right? Okay, so what are the 3 choices of small intestines?
Duodenum, jejunum, and ileum.
Okay, would this look like the ileum?
No.
Because the ileum you're gonna see what?
Lactose.
Pious patches. Okay, you may see that one too. I don't have a slide of that. Okay, and what's the next obvious one you'll see? The duodenum, right? So what does the duodenum have special in it?
Brunner.
It has the Brunner's glands, right? So we can't ask you Brunner's glands. Okay, we used to ask that before, right? These are these clumps right here. However, where number 9 is, we'll ask about what layer is that? Where does the Brunner's gland sit? What layer is that?
Submucosa.
Submucosa. Okay, so all of them will generally have the same setup. If you see a bunch of glands, think submucosa. Okay. Okay, so only thing that you see on this slide is that it points to this white-looking thing. That's a
Goblet.
goblet cell secretes mucus, right? Now, other than that, we see some glands, we see goblet cells. Well, what are you thinking? Where in the intestines is this at?
Colon.
So it's a colon, right? Colon, you'll see tons of goblet cells, tons of glands. You wouldn't see those what? Villi like you would normally, right? Okay, you guys get that? Okay, and we saw it here as well, right? You guys saw it on the slides here? Okay, good. So that is goblet cells, and that is, of course, the colon. Okay, so this
Carotid.
one is identify the slide.
Carotid.
DCT and DCT, so.
No, that's a parotid. Yeah.
Parotid.
Parotoid.
That's the parotid.
Okay, all right. So my rules about the parotid, the submandibular and sublingual. We look for two types of acini, right? So if it's predominantly serous acini, then it's a parotid, right? Now how do we tell it's serous acini? Normally it takes on a darker stain. So it's either it's gonna stain pink or it's gonna stain purple. Okay? So if it's and here you can see it's predominantly, right, it's all covered with these serous acini. Okay, so definitely this one is parotid. Now so how would you answer number 13? What is that sitting on? Yeah, on the actual test you'll have an arrow pointing to it. What is that? And that's the serous acini. And what about number 12? Parotid duct. Okay, in this one, what do you want to say this one is? Identify the slide.
Submandibular.
Submandibular? Okay, good. Yeah, I call it 50-50, right? Why I call it 50-50 because you'll see both serous acini and mucus acini. I call it 50-50, only me, okay? So, once you see a slide that looks like this, meaning a combination of both, then it's definitely going to be submandibular. However, we do see an additional structure there, and I call it the pal cap or the basal cap, however you want to say, right? But that is the serous demilune, right? Serous demilune, and that's on your list, okay? That's on your list just in case, all right? So again, what slide is this? Okay. Not a very good picture,
Liver.
but you guys get a gist of it, right? So identify the slide. The liver, and it's pointing to the
Central vein.
central vein. And before we used to ask the septors, but we can't ask the septors. These are septors, but we're not going to ask that anymore. So, not too clear, but we can see a little impression of it right here. What would you think that this is right there? If you
Portal
want to
triad.
interpret it. Okay. That'll be the portal triad. Again, the ones you see under a microscope are going to be crystal clear. You wouldn't be able to. Oh, thank you. Right.
Stop stealing phones, Mattel.
No,
Okay, good. Right?
technically I did steal that because that was a wrong delivery.
Okay, identify this one.
Sublingual.
Sublingual. And if we point to one of these, what would you call that?
Mucous.
Mucus acini. And you see how it's grayish, whitish, and it takes over the entire slide. Okay, so this way we say mucus acini predominates. So this one definitely is a sublingual. Okay. Okay, so this one says identify the slide.
Kidney.
What slide is that? The kidneys, okay, so it's a giveaway, right? Okay, so what is number 20 pointing to?
Glomerulus.
The tip of the pointer. Right, because it's the tip of the pointer, so that's the glomerulus. What about the tip of the pointer for 20?
Capsular space.
The
Glomerular.
right, the capsular space, the Bowman space, okay? And they say here, identify the region. What would you say the region
Cortex.
is? It's a cortex. So if you see a bunch of renal corpuscle, because the whole thing is a renal corpuscle, right? A renal corpuscle means that it includes the Bowman's capsule and also the glomerulus. So if you see a whole bunch of these, you're in the cortex. Now, how would you know that you're in the medulla?
The DCTs and PCTs.
Right, you'll find a whole bunch of the tubules, okay? DCTs and PCTs and stuff. Okay, identify this slide.
Zoom in of the kidney.
Right, so it's a kidney again, okay? So this therefore is what?
The glomerulus.
Glomerulus.
And this here is the
Capsular space.
Okay, now I want you to compare two, right? I want you to compare this one versus this one for me. And if I ask you what is this one,
D,
that's a DCT, and this is
P,
okay. Now I know you'll say, well, the DCT does in fact have microvilli, right? It does have microvilli. However, the PCT, right, has a whole bunch of microvilli. Okay, so in order to keep things simple, right? If you see one that's nice and clear, that's the one you're gonna go for in terms of the DCT. But if it's cloudy, meaning it has a whole bunch of microvilli, then you take proximal convoluted tubular. Does that make sense?
Yes.
All right. Okay. Good. Good. You can. Good. Okay. So.
It's also pretty.
So what do you say if you had to take a shot at this? What is 24?
DCT,
It's a DCT.
Okay, what is this one right here?
P,
And what region is that?
medulla,
Okay. All right.
aorta,
Identify this one.
The ureter?
Okay, so this right here is the ureter. How do you know it's a ureter?
transitional epithelium,
The shape, right? So all the ones that I've shown you in classes, I always show you that star shape. Now it's still a little. I call it a star. Sorry, it's not really a star, but I call it a star. You know, because you can actually see the lumen. Now notice that the epithelial here, right? The epithelial here is a little different. Okay, it's a little different than the epithelial the transitional epithelium you'll see anywhere else. But this, of course, you know, is transitional epithelium here. Okay? Yeah? Okay. So you guys on question?
Are these pictures going to be the same ones that we get on our lab? Like, are they going to be different magnifications? Like, if we got this one for ureter, would it be that one? Or would it be like?
Right. And on this slide, it could possibly be two magnification. It could probably be medium or low. This one is medium, okay? I know it looks really humongous because I kind of blew up the picture, right? But for me, I would like you to see different characteristics that will not confuse you and will make you jump at the answer. Okay? So in other words, that's why I say the star shape, and that will actually help you to determine exactly what it is, if you do have that slide. Okay? Yeah? Alright. Now I know we're all from different classes, right? And the bonus question is obviously different from that's the only thing the instructors, they can change the bonus questions, right? So for my class, I probably put 3 microscopes for you guys, okay? Extra microscopes for you guys. My class.
Can I go
No?
work?
You guys don't like that?
No.
can I transfer?
Okay, okay. Alright. If you guys don't want it, I would put it, okay? Okay. Now identify this one.
Bladder,
Right, this is a urinary bladder, right? And why do we say it's a urinary bladder?
Transitional epithelium.
It's we
Because
see
the
transitional
cap
epithelium
things.
there, okay? Transitional epithelium. But what kind of gives it away, right? In the bladder, although both the ureter and the bladder has transitional epithelium, we'll see these kind of cells, these dome-shaped cells. Normally, it's given a name. It's called umbrella cells. Okay, it's not on your list. So the way how it was set up, we can ask this, but I can't ask it anymore. So the only thing you're gonna do here is identify that it's in fact the urinary bladder, and of course this right here, right, is just transitional epithelium. Okay, but how would you identify? Just look at these dome-shaped cells on top, and it always looks like it's sloughing off the bladder. Okay.
because
So
it
let's
is.
go back one more time. You guys see that?
Mm-hmm.
See the difference, right? It doesn't, you don't see that nice little dome shape like we have there, okay?
Ovary.
Next one, identify. Okay, the ovaries, right? The ovaries, okay. So let's identify number 35. which points to the whole thing. What would you call that?
Tertiary.
Huh?
Tertiary.
Yeah, the tertiary follicle, and the tertiary follicle is also called the mature Graafian follicle or the fascicular follicle. Okay? How do we know it's the any of those mature Graafian
It
follicle?
has
How do we
number
know that?
34, the antrum.
Right, it has to have this antrum right here. So this antrum more or less gives it away, okay? This antrum here gives it away. Other things they ask you, I'm not still gonna mention these words because it's not on your lab list, okay? But you used to ask a whole bunch of things here. We don't ask it, they took it off the list. But anyway, what's this right here?
Secondary oocyte.
Secondary oocyte. And this only has one layer of cuboidal cells, so it'll be like
Primary follicle.
right, primary follicle. Okay, so let me do a little bit of explaining. So, when we look at your ovaries, not only do we look for things like corpus luteum. Corpus luteum is easy. If you haven't seen one, make sure and see one before you leave. But we also have to determine what is a primordial follicle. Right, and we'll see one in the next slide, okay? The primordial follicle, it's surrounded by simple squamous epithelium. Right? The next one is the primary follicle. And the primary follicle is surrounded by what?
Simple squamous.
Simple
simple
cuboidal.
Simple cuboidal epithelium. And the secondary follicle is covered by same
Stratified.
cuboidal, but yes, it's multi-layered. So you'll see a single layer for primary, and then you'll see a double layer of cuboidal cells for the secondary, and obviously for the tertiary, you're gonna see an antrum. Is that cool?
Mhm.
Alright, so don't, and again, the ones you see, if it's under my, if that's one of the questions, right? It's gonna be perfect. You're gonna make sure you can see that cuboidal cell. Okay, is that good? Yeah? Alright. And everybody knows there's a difference between oocyte and follicle, right?
Yes.
Okay, the oocytes are inside. So if you talk about primordial follicle, primary follicle, and secondary follicle, what type of oocyte you'll find in those?
Primary.
Primary. Okay? The only one you're gonna find a secondary oocyte in is the
Tertiary
tertiary.
mature
Beautiful.
Graafian.
Question, Nichols.
I'm sorry, what's number 33?
Number what?
33.
33.
That would be the
Yeah, this
primary
one would be the
follicle.
primary follicle.
Okay, what you said, what's
Primordial.
primordial and primary? It was the
Primordial
Primordial
has
has-
simple squamous,
Uh-huh.
and primary has simple cuboidal.
thank you.
Perfect, beautiful. All right, let's since Nichols asked, let's look at some primordial. Okay, this is like a late primordial, but let's look at these right here. This is here, this one here, or even this one right here. Do you see this simple squamous epithelium? Do you see it?
Mhm.
Mhm.
Okay, so this definitely is the primordial, okay? Now, primordial is just one of the stem cells that eventually differentiate, and we end up with a mature egg, okay? So it houses the egg itself, alright? Okay, so what is this line again of?
Ovary.
Ovary, right? Okay, so what do you think this one is, number 37?
Primary
Okay.
follicle.
Is a primary, because we only see one leg. And what is number 38?
Primary oocyte.
Okay, very good, primary oocyte. Everybody okay, so? Alright. Okay, identify this slide.
Testes.
Testes, okay, so the slide is testes, right? Not all of it will be wrong and nice like that, but it is a testes, okay? And now it's saying number 42. And number 42 is showing you the whole thing, right? It's pointing here, or if it's pointing here, or it could point here, the same thing, right? So what do you say 42 is?
Tunica.
The
Alpha
seminiferous tubules, okay, seminiferous tubules. Okay, so we can't ask you any of these, like this, the spermatogonia or anything. Can't ask you that anymore, right? But we could ask you this. What's this area here? This is a lumen. And what do you see right here?
Spermatocytes.
Oh, this.
Sperm.
Right, these are the spermatozoa. Okay, so we're going based on your lab list, okay? So again, lumen, spermatozoa, seminiferous tubule, being able to identify the testes, and one more thing they ask you for. This is it right here.
Interstitial cells.
That is what type of cell?
Leydig or interstitial?
A Leydig or interstitial cell. Hey, I could point to any cell. I could close my eye and point to this cell here, right? Once it's not inside of this, I could point to any cell really, right?
It's interstitial.
Right? Because these cells, they're different. The Leydig cells, it's just, they're a bit different, right? But the main thing here is to understand if it's outside of the seminiferous tubule, just call it interstitial cell. Yeah? Or Leydig cell, whatever you like. Well, what is the secondary question? What does the interstitial cell produce?
Testosterone.
Testosterone. What stimulates the interstitial cell
Luteinizing
to
hormone.
produce testosterone?
GnRH.
Where does luteinizing hormone come from?
Anterior
Pituitary.
pituitary.
Anterior pituitary. Okay? So now you know the whole pathway, okay? Okay, I know this doesn't look like a slide perfectly, but what do you think this one is?
Uterus.
This here is a uterus, right? And how do we know it's a uterus?
Uterine glands.
Say again?
The endometrium.
Yeah, these cells, these are
Uterine glands.
uterine glands, sorry, uterine glands. See a whole bunch of that. Now, on the other slide, you see it's the stained blue, and I know most of you guys have that picture where it's stained blue. We also have another one that's stained pink, not so good. The blue one is stained really well, and you can actually see these uterine glands, okay? So if you see a bunch of these uterine glands from here to here, what you gonna call it?
Endometrium.
Endometrium.
Endometrium, and this part is the,
Myometrium.
and this sliver of
Perimetrium.
perimetrium, okay? Okay, alright, so next one is identify the slide,
Mammary gland.
the mammary
Active.
gland, and what is it pointing to?
Secretory
Like-
alveoli.
Secretory alveoli, alveolus, and this is the,
Lactiferous
Lactiferous
duct.
duct.
okay, okay.
Just a question, real quick on that one. Are we able to differentiate between a lactiferous duct and a lactiferous sinus under the microscope?
Nah,
Okay, so just lactiferous duct then.
yeah, let's call all of them lactiferous duct.
Okay.
Right? Although, right, if you look at the growth structure of both of them, the sinus will always be bulging out,
Okay.
right? But the ducts itself is normally straight and, you know,
Okay.
so it's really hard to determine that under the microscope. really
Okay,
hard.
so that would more just be for the actual model.
Yeah, the
of
actual model.
Okay.
Okay, and what's this one right here?
Still mammary.
Same thing, right?
Mm-hmm.
It's the same thing,
It's
okay?
just inactive, right?
Right? This one it's kind of going in a little bit activity, but how you really know that most of it is inactive because you see myoepithelial cells, but I wouldn't worry about this, right? Right? 55, right? You see a bit of milk there, right? So those are just the secretory alveolus, okay? And also, I'm pointing to my screen, you see what I'm pointing to. Okay, so these right here, 55, is still secretory alveoli. These right here, it tells you that this is not really inactive, it's become inactive, right? And that's because you see my epithelial cells, again, it's not on your lab list, right? So we should be only saying secretory alveoli. Remember that this slide is the mammary gland, and of course these are
Lactiferous ducts.
Lactiferous ducts.
lactiferous ducts. That's all you're supposed to know, okay? Alright, this one is my giveaway, okay? Okay, so that's, what slide is this?
Liver.
Okay, this is the liver. Again, if you see anything close to the portal triad, if you see like you're pointing to this one, don't say hepatic portal venual, say the whole thing, right? Because again, you know, it's a whole thing on your lab list. It's not just the hepatic portal venual, hepatic portal. It's not like that, okay? So let's say portal triad, okay?
Tooth.
Okay, well, what's this here? Teeth, okay, you guys know more about this than I do. So the top part, so know the parts of the teeth, okay? I just have two parts here for you, and this is the,
Enamel.
and this is the,
Pulp. Cavity.
okay, so just in case there's a picture floating around, I don't know if it's on your chest or anything, but make sure I know the parts. It's on your lab list, know it, okay? Okay, what is this here of?
Stomach.
Okay, this here is the stomach, okay? I was supposed to make some changes, but I was too busy, okay? But let's look at this right here. I'm gonna put a point here, and you see this right here?
Yeah.
What are you gonna call that?
Circular, circular.
Right,
Circular form.
oblique circularis, right? Remember, you find that in the small intestines, okay? So anywhere in the small intestine, you can literally find that. But where I don't have any point here, so how would you identify number 65? You just say duodenum.
Mm-hmm.
That's all it is. Okay? There's nothing pointing to anything there. Alright? 67. It's
Ruga.
literally pointing to something. So you're gonna say it there? Rugae, right? Alright, this arrow here, I kinda made up for that with this one right here. Because it's supposed to be slightly to the left side here. However, they took that off your list, okay? It's a lower esophageal pincer, it's not on your list. So let's picture this one all the way down here, like you saw on the bottom on the table. So that's the pyloric pincer. This right here, of course, is the
Lesser curvature.
this here is the.
Greater.
What about if I ask you what's this region right here? We'll say
Fundus.
fundus. Okay, what about this region here?
Cardia.
Cardia. What about this region here?
Pylorus.
Okay, so basic stuff. There's no reason why you can't get a 100. No reason. Okay, so what is this a picture of?
Liver.
Right? Okay, so let's start off with number 69. Who wants to give me 69?
Left lobe.
Huh?
Left
Left
lobe.
lobe. Okay. What about 70?
Common hepatic duct.
Okay. So that is the common one.
Hepatic
Bile
duct.
duct, okay.
Hepatic duct.
71.
Cystic
Okay. 72.
Quadrate.
quadrant.
With a Q.
Q.
With a Q.
Yeah.
Okay. All right. And 73.
Gallbladder.
Okay. Let's shoot for something detailed. What's this right here?
That's the common hepatic duct.
Common hepatic duct. And what about this one here?
Left hepatic duct.
And what about this one here?
Right hepatic duct.
Alright, what about if I just circle the whole thing?
Photohepatis.
Portal hepatitis, okay? Good, guys, good. Alright. So here, of course, we have two ligaments, right? Round and also falciform. So which one is this one right here?
Round.
Okay, this time, what is this right here pointing?
Caudate with a C.
Caudate with a C? Okay, good. Not with a Q, with a C, okay? An easy way, because folks normally confuse both of them. They confuse them, right? So I always say this here is the IVC. And if that's the IVC, it has a C in it, so that's why I get a C here for caudate. That's an easy way to remember it, okay? We do forget things, okay? So that's an easy way not to forget it at all, okay? Okay, what is this, a model histological representation of? The liver,
Liver.
right? Good. So let's see, what is 78?
Lobule.
Okay, so notice the whole thing. What about 76?
Central vein.
What do you think 77 is?
Portal triad.
What about 79?
Sensor.
You can just say,
Sinusoid.
Portal trial.
right? So you can just say this one right here is the sinusoids, right? These little roads you see here is the sinusoids, okay?
You said that with your whole chest.
Okay, so this right here,
Portal triad.
what I'm trying, and you have seen that with that representation there. So none of you can make that mistake. Okay, so number 82, I don't know if you can see that from there.
Copper cell.
Macrophage.
Cooper cell.
Right, Cooper cells or,
Which one?
huh?
82.
82. You see this little star thing in here? There's quite a couple. There's one
KPFER.
here, there's one here. Okay, so those are just the macrophages, okay? Or Cooper cells is right terminology that they use for that. What about right here? What is this right here?
Hepatocyte.
Hepatocyte.
Hepatocyte. Okay. Okay, so this is a picture of the,
Colon.
alright, the intestines, right? So we see large intestine to be specific, we do see smaller ones. Okay, so what is 83.2?
Coli, coli,
What about 84?
cecum,
Secum.
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 Zika. What about 85 here?
mesenteric,
Okay, what about 86?
pancreas,
Pancreas.
What about if I point to this ridges you see here?
plicae circularis,
Okay, plicae circularis. Okay, and all that of course is the duodenum.
I have a question, if there is a model that's wanting Haustra as the answer, I mean, that could be pointing to anywhere on the large intestine, so how would
It'll
Very
just
that
be-
good question.
differentiate?
it'll
Very
just
good
be an
question.
arrow.
Right? For me, if I had to ask you the Hostra, I'm only gonna put it on one of these.
But that's what I'm saying, is 84 could be technically on just one part
Where's it? For?
At the bottom.
at the bottom there.
Yeah, but because here's the end, you see that it's like a blind-ended tubule.
Okay.
So if I put it all the way at the end there, we
Do you
gonna
think the
say
question would be constructed to say like what section is this or what,
Right.
you know,
Yeah. But
What
if
region?
it's just pointing to this
what
right
region,
here,
yeah.
if there's a pointer on this or even a
Structure.
number in this,
Coming to-
Yeah,
How do
it
you
should be
gonna say
structure
this?
versus region.
yeah.
Okay.
Right? So
Thank
this
you.
right here is still gonna be Hostra.
Mm-hmm.
But if I include like,
that would
how
be
I would
the
do it, if I include more than one,
Mm-hmm.
then
descending.
of course you say is the descending,
Descending,
ascending, or
ascending,
transverse.
Transverse or
Okay.
sigmoid.
Yeah, so 89 would be
Yeah,
Hofstra.
so 80,
One
yeah, I
thing,
see that.
one thing I left out, because I messed up on this before. This right here, of course, you know, is a pancreatic duct, right?
Mhm.
And there's two parts that comes all the way to the duodenum, right? Do you know the names of? You only have one name. Okay, what did
Duodenal
they call that
papilla?
right here?
Ampule?
Right, the duodenal papilla, right?
Yeah.
Okay, so if it comes this way, now there's a minor and major, but let's use the terminology they have there, okay? Let's name one and absolutely right. Alright, what is 87?
Left lobe,
Left lobe, left lobe.
88?
splenic
Splenic
flexure,
Okay, splenic flexion.
Flexion.
What about, okay, that's your question, eh? What's number 89?
Ostrom.
Oh, sorry, just pointing to one, okay? What about 90?
Appendix.
Vermiform.
Appendix.
Appendix.
Okay, I never gave this before, but this thing shapes like an S.
sigmoid colon,
Okay, yeah. I didn't give that before. Okay, so we have 91, it looks like fatty tissue.
Greater omentum.
Great omentum. Okay, and here goes that point again, but we're gonna move this point and we're gonna put it right here instead.
ileocecal
Ileocecal
valve,
valve.
Ileocecal valve. Okay, okay. Okay, so we have number 93. What's 93? Be
Kidney.
specific.
Papilla.
Right, it is the renal papilla. Now, what about 94? Where is it in 94?
renal pyramid,
Right. I'm glad you guys didn't say medulla, right? Now, if the question was asked, identify the region, right? Then you know that is the
Medulla.
medulla, okay?
If it's
Next
structure,
one.
then it would be pyramid.
That's the structure, yeah. And number 95, what's that?
renal
Renal
pelvis,
And number 96?
minor calyx,
Okay, what about right here? What's this one right here?
major calyx,
Major calyx, okay. Okay, so we had 97. What's 97?
cortex,
Cortex. Okay, and 98.
arcuate,
Arteries.
arteries,
Okay. And number 99.
renal column,
Renal column.
Renal column. Okay, and 100.
cortical radiate artery,
Okay. So here we have quite a few. What is 101? I know it's kind of difficult to see where the point is right here.
DCT,
DCT.
No,
here, right?
glomerulus is underneath it, and it's connecting to the collecting
Oh.
duct.
Right? How do we know it's a GCT?
It's draining into the
It's
collecting
going
duct.
to the collecting duct, okay?
Or
What
ureter.
about this one right here? What's it pointing to?
Glomerulus.
Okay. Okay, what is 104?
Loop of Henry.
Okay, what is 105?
PCT.
collecting, so convoluted to.
The what? Distal
Proximal.
proximal. Right? So leading from the Bowman's capsule has to be proximal. Okay. What about 103?
Collecting duct.
Collecting duct. Okay, I know you haven't seen this one, but you see the things your instructors do for you crawling around the ground?
I would get one of those creepers that mechanics use.
Okay, so.
Go to the automotive department.
Okay, so what is this right here?
Renal capsule.
Oh, for this one, you're gonna have to say renal muscle. Okay?
Renal capsule
If,
is the outside.
if, for example, it was pointed to here, then you could say Bowman's capsule. But it's pointing to the whole thing. So the whole thing is a combination of both, okay? This right here, I know you can't see this, but it's going into this glomerulus right there. What
Oh,
do you
that's
think
the
this is there?
afferent arterial.
Yeah, the afferent, okay? Okay. Alright, so we have this one, we're gonna start at 107. What's 107?
Fundus.
Fundus. Okay, what is 108?
Ovarian ligament.
You guys sure? Or is that the suspensory ligament?
No, it's ovarian.
Ovarian ligament, right? The trick is that everybody gets confused with this, right? But if it links with the fallopian tube, right, this one will be the suspensory ligament, okay? Just making sure you know that. Alright, what is 109?
Fallopian.
Suspension.
Number
Oh.
109.
The ambula.
Right. Or you can just say, since it's general here, you can just say fallopian tube, oviduct, uterine tube, okay? But if it says number 14, then be very specific.
Infundibulum.
Infundibulum. Okay, what about 110?
Fembrae.
Okay, what about 111?
Endometrium.
Alright, be specific, endometrium. What about number 2 here?
Cervix. Or
What
isthmus.
about this right here?
Vaginal canal.
Okay. And number 12?
Ovary.
Okay. Now, isthmus, don't worry about isthmus, alright? Because there's too many isthmus on this thing right here, okay?
So 15 would be the suspensory ligament?
Mm-hmm.
Yeah, I would, say again?
At 15. Off of 12.
Yeah, suspensory, yeah, suspensory. Okay, the last time I asked this, folks told me that this picture was the breast.
Yeah, I was in that.
You in that class?
That was
It
you,
doesn't
McAllister.
look nothing
Huh?
like that,
That was
okay?
you.
Absolutely
I know
not.
it's anatomy, but,
What were you thinking?
alright. Okay, so we do have a similar model, okay, we do have a similar model. So, let's see. So we know, of course, we're looking at the ovary. So what's number 113?
Corpus luteum.
114
Corpus albicans.
and 112?
Tertiary.
Tertiary.
Okay,
Oh,
tertiary
okay.
or mature grafted follicle fasciculum, whatever you want to say. And this one right here is the, oops.
Oh,
I
primordial.
only see
No,
one
no,
layer,
primary.
This one, so this is primary.
Primary,
This is
follicle,
2 layers.
Secondary.
Okay, what about this one right here?
Primordial.
Primordial.
Alright, I know, you wouldn't have that one, okay? Okay, everybody knows what this is, right?
Yep.
Okay. 117.
Vas deferens.
Reductus deferens.
Okay, vas deferens. 118.
Urinary bladder.
119.
Seminiferous.
Okay, a lot of folks say seminiferous tubers. Be careful. You guys all said it right. Seminal vesicle. This right here is D?
Prostate.
This right here is D?
Epididymis.
This right here is D?
Testes.
And this here is D?
Scrotum.
Okay. What about if I was to wrap a string around this whole thing here?
Spermatic cord.
Somatic cord. What about this blue thing here? What would we call that?
Piriformis plexus, something like
Pinniform venous plexus. Okay, it's there. Alright. Okay. Now, Brittany and what's her name again? Oh,
Julia.
Julia had asked about the dantos muscle and the cremaster muscle, right? Just to make sure everybody knows that, okay? You see, the dantos muscle is always associated with the scrotum, okay? But the cremaster muscle actually covers the entire testes and it goes up. Okay, so if you see muscle going up like that, and then when you look down, you see the scrotum, and you see the muscle here. Well, this one is dantos, and the muscle that goes up will be the cremaster muscle. Okay. And we do have a mod there. Make sure to check it out for you. By the way, what's this right here?
ureter.
Alright, so some of these things are not on the list, so let's go straight to this right here. What would you say this is right here?
I'm sorry.
Pinniform, right?
Plexus.
Venus plexus. Okay, what is one of these here?
Lobule.
A lobule, right?
Lobule.
Lobule. Now, if I just point to this and ask you, be specific, what is this here?
Seminiferous tubule.
Seminiferous tubule. Okay, so now we have this right here, and it's covering.
Tunica vaginalis.
Okay, it's covering, but look how it goes right here.
Oh, tunica albuginea.
So this one, of course, will be considered to be the albican. Let me make sure. My hands I don't know. Okay, see all that here?
Is it albicans or albuginia?
Albuginea. Okay.
Albicans is in the open.
Okay, so don't say tunica vaginalis. That'll be on the outside, the outermost. Okay? So the outside right here, of course, will be the tunica vaginalis. And again, there's a model out there for you guys to look at. We come into the end. So 129 and 130.
Fallopian tube, and 30 is
Alright, so 129 is the fallopian tube and 130 is the
uterus.
uterus. Okay, what's 131?
Ureter.
Right, make sure and spell that right. Some people have been spelling it U-R-E-T-H-R-A. Don't mix it up, okay? Right? Don't mix up ureter and urethra. Don't mix it up, alright? Okay, what is 132? Uterus and muscle?
Yeah.
What about 134?
Trigon? No.
Internal.
Urethral.
Internal urethral orifice? Okay, is that still on your list? I can't remember.
No.
Yes.
Okay.
Is it?
133 would be the
I'll pick it.
trigon.
I can't check.
133 is your trigon?
The trigon's on there.
I don't think the internal one is, I think it's just
Okay,
external.
don't worry for that.
Yeah, don't worry about it. No.
Okay, 135. I like that.
Rugae.
Okay, good. Alright, so we have,
Intestinal
that's that
flora.
one right
That
there.
would be the ilium.
So what is 140?
Lacteal.
Lacteals? What's 141?
Muscularis externa.
Alright, let's call a couple extra. What's number 1?
Villi.
Villi. What about number 4?
Muscularis mucosa.
Number 4.
Muscularis mucosa.
Muscularis mucosa, okay. And what about this area right here?
Submucosa.
Has a bunch of glands and blood vessels,
Oh,
so
okay.
submucosa. Okay, what about this area here? What would you say this area here is?
Mucosa.
Lamina propria.
Oh.
Okay, so this is a picture of the mammary gland. Okay, so what is number 142? You may not be able to see, it's kind of
Lactiferous
dilated.
sinus.
Lactiferous sinus.
Sinus, okay, and 143 is straight, so you can pull it.
Lactiferous duct.
Okay, what about this right here?
Low.
Lobes.
The lobes. This right here is the
Pectoralis major.
pectoralis muscle, and the rest, you guys know the rest, okay? Okay, that's all. Okay.